educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not. Well, hi, Ruth Ellen. How are you today? Hold on. I know technology. Really, I do.
I'm good. How are you?
Excellent. Hello, everybody. Welcome to Daily with Doc. My name is Becca Dukes, and I am honored to be able to be here with you today as we bring more information that you can put in your toolbox that empowers you to make those choices that you don't know that you have. And in fact, maybe even give you something to think about when it comes to the things that you've been told are healthy and you've been told they're good for you, yet you're still sick. Well, today we are going to be talking about a lot of those things that are said to be genetic or predispositioned, and in all actuality, it's not. Simple nutritional deficiency. And I know from personal experience that the information that we're going to be sharing on today's show is in fact truthful, works, and folks, it's an amazing journey on the other side of being sick. So sit back and get ready. If you are watching us on any of the live streams or even a replay, we are here live in Zoom at DailywithDocZoom.com, Tuesday, Wednesday, Thursday, Friday, from 12 to 1 p.m. Pacific time. That's 12 to 1 Pacific, 12 to 1 p.m. Pacific time. And again, my name is Becca Dukes. As the hostess of this program, I'm also the Director of Student Services for the Institute of Holistic Health, where we teach others how to be empowered, how to help empower others when it comes to the 4 areas of physical health and how they're affected by nutritional deficiencies, and also the solutions to correct those deficiencies, but also the body as a whole. So it goes more spiritual, mental, physical, the whole mindset. Because when you've got a mindset that you're sick, you're always going to be sick, that's exactly what your body's going to deliver. And when you break free from that, the body breaks free as well. So without further ado, it is my honor and privilege to share with you the information and the doctor that actually put information in front of me that I was able to take action on and do all on my own. And when I thought there was nothing else, thought that I had tried everything, I thought, okay, this is the last thing. Well, I'm so glad that I gave it a shot. I gave it more than 90 days because with the first 90 days, I'm like, if this is all I get, it is so worth it. And when I've kept going and now going 8 years, I am just loving life, loving what I do. I found my purpose. And folks, there's 2 important days in life: the day you're born, the day you find your purpose. And when you find your purpose and you feel good about what you do each and every day, especially when it's helping others, I can't think of a greater career. Well, Dr. Joel Wallach, he has been helping others for almost 75 years in looking at, what is missing and putting into your mouth the nutritional things that are missing so that the body actually has those raw ingredients to work with. Because if they don't go in our mouth or on our skin, then it's not in the food. So how else is it going to get there? Well, through his schooling, working his way through college in the pathology lab, he has a Bachelor of Science in plant and soil studies. He has a doctor of veterinary medicine, which he also has 3 postdoctorates in pathology. He has done close to 30,000 autopsy reviews on over 452 species of animals, with about 3,000 of those being human. So I can't think of anybody that has dug deeper into the body, what's going on in the body, what's missing when there's disease that occurs, and then connecting those dots and seeing the correlation from the animal world and the human world, and also figuring out, okay, this is missing, this disease occurs, there's got to be something that needs to be done about it. So he did something about it. He actually, after finding first non-human case of cystic fibrosis and telling them that he actually knew the cause of it and he could provide them more of a study group, it wasn't what they wanted to hear because, of course, cystic fibrosis is a human genetic disease. Well, he got fired because he proved to them that it wasn't. So he went on to teach nutrition at a naturopathic college, where he actually became a naturopathic physician as well, and has just been so strong in leading this crusade to make sure people understand our food does not have what it needs, for what the body needs to be able to sustain itself, let alone thrive. And this program is a result of that, as he has put together formulas and started a company many, many years ago that he has been able to step away from so that he can focus on spreading the message of hope when it comes to not having to look at life based on genetics or what's going on in the family, because you as an empowered individual can make choices that will change your life. Today, we're going to be talking about metabolic syndrome, Dr. Wallach. So what are your thoughts on metabolic syndrome?
Well, it's a great thing that's going on here. I can't thank you enough for your participation in it. Metabolic syndrome goes back to the beginning, but let's go to 1945. 1945, a handful of doctors after the Second World War were presented with some patients, and they really didn't know what was going on. So they said, "Oh, it's got to be a genetic thing." Okay, it's got to be a genetic thing. And the genetic thing, of course, they called it the metabolic syndrome. And basically, they're able to give prescriptions to help relieve pain and swelling and that kind of stuff. It really didn't get rid of the disease. The disease kept getting progressively worse and so on. And then suddenly, after they came out with the news about it, and by 1950, there were so many doctors coming out with the diagnoses of metabolic syndrome, because this sort of syndrome, this things all together here, where people were having high blood pressure and they're obese and they have diabetes and they have arthritis and osteoporosis and heart disease, and they got things going on with their thyroid, and just it's amazing how many different problems they had. And so the doctors just throw up their hands and say, well, this is genetic. The best we can do is give them some pain relievers and anti-swelling drugs and this kind of stuff. But we can't prevent it because it's genetic. Okay. And you just have to live with it and do the best you can to deal with the symptoms. Well, having the background that I had, and I was presented with some of this material in patients, and they said, "No, this isn't genetic. This is a very simple cluster of nutritional deficiencies, just a cluster of nutritional deficiencies." Because I've been looking at nutritional deficiencies for 50 years, and so they jumped out at you. And so when you look at this, and we're talking about obesity, let's see here, 40% of Americans are obese. 40% of Americans are officially rated as obese. 18% are severely obese. 43% of males and 41.9% of females in America, defined as 25 pounds overweight for their height and age and so forth, are obese. Okay. And the cause of obesity is nutritional deficiencies. Okay. And nutritional deficiencies cause a behavior called pica, where you're trying to eat anything, trying to satisfy this craving because your body's telling you to look for these nutrients that are missing. Okay. And the cravings, of course, do not give full satisfaction. Okay. Hence the overeating. You can eat 5 meals an hour. Say 5 hours a day, that's 20 meals a day. And that's why people gain so much weight. And then, of course, once you start taking the nutrients, suddenly now you're losing a half a pound to 2 pounds a day. And it takes you a couple of months to get down to where you need to be, sometimes 6 months, depending on how big you are. And of course, this goes back in history. The people who were legendary for having these endless cravings and gaining weight were pregnant women. While you're pregnant, the baby is asking for nutrients. Well, that's partially true. The baby is asking for nutrients, but your body is also asking for nutrients. And so pregnant women would eat and eat and eat and eat, and that's why they would gain so much weight. And this it goes back into history. It's written in history. And of course, one of my favorite things from the old Bible is people would ask 2,000-3,000 years ago, who lived the longest? Well, the people who lived to be 200, 300, 400 were ones who actually followed the directions, and they actually lived in the land flowing with milk and honey. And people thought, everybody's heard that. You live in the land flowing with milk and honey, you're going to live longer. The other thing is cow's milk, goat's milk, camel milk. No, it was glacial milk. The glaciers are grinding up the rocks and up on the top of the mountains. And the water coming down the side of the mountains, you could be half a mile away or a mile away looking at that mountain. You see this stream coming down the side of the mountain. It looks like milk coming down the mountain. So that's what they're saying. Oh, you live in the land flowing with milk and honey. That's why it was flowing, because it's coming down the mountain in these streams. And this is quite interesting. And of course, I keep getting these people on the autopsy table, human beings on the autopsy table, and they're obese and everything, but there's nothing really in their records, from when they were alive, and that showed what was going on. Now, okay, let's get serious here. Okay, obesity is a big one. Okay, then of course, you're talking about diabetes is also important here. 37.3 million cases of diabetes in the United States, 11.3% of the population, 96 million pre-diabetics in the United States. Okay, and the annual cost is $342 billion just to treat the symptoms of diabetes, not to prevent it or cure it. Holy moly, when you think about it. And then, and we've talked about this before, arthritis, we spend $626.8 billion a year just to treat the symptoms, not to prevent it or cure it. And when we join Canada and the UK, the three of these cultures, each year we spend $6.5 trillion just to treat the symptoms, not to prevent or cure osteoporosis. That's just osteoporosis, just to treat the symptoms. $6.5 trillion a year for three cultures. This is crazy when you think about it. Okay. And the doctors say it's genetic. There's nothing to do about it except treat the symptoms, relieve some of the swelling so you can move around and all that kind of stuff. And it just went on and on and on, continues to go on and on and on. Well, now we have the book coming out here. It's going to be, I think we're going to get it at the printer, today or tomorrow or Friday this week. We're looking at getting it at the printer. Okay, this is very exciting. And so we should have it available because of the system we're going to use. We're going to have it available by next week. That's good. I'm very excited about that. And it's very similar in size to the outside measurements of the book, It's All in Your Head. And so they're going to go as a set. If you already have the book, It's All in Your Head, you just have to buy the book, The Metabolic Syndrome. And if you don't have It's All in Your Head, you get the set, and you get a little discount. And what is it, Rebecca? The book, It's All in Your Head, sells for what?
So It's All in Your Head sells for only $12.95 US dollar.
Okay, so almost 13 bucks. Okay, so we're looking here. This book, Metabolic Syndrome, is, I don't know, 8 to 10 pages longer.
10 to 15 pages
10
longer.
to 15, okay, 10 to 15 pages longer. Okay, and it's really giving you a lot of details, going into the details of why we have these problems. I mean, we're talking details here because of all the pathology that I've done, all the clinical cases I've seen all over the world. So this is irrevocable. Irrevocable. This is stuff that's going to change humanity when it comes out in the next couple of days. Also, we're going to encourage you to do this. We're also going to give you a gift, okay, a CD, okay, and the CD is called
Kitchen.
Hell's Kitchen. Hell's Kitchen. And I listened to that again this morning. Oh my gosh, the information in that CD, Hell's Kitchen, will blow your mind, because doctors say, oh, don't waste your money on vitamins and minerals, just eat well and get everything you need. Any doctor who says that should have their licenses suspended. They need to go back to school and get taught what's really going on here before they get their license back. Okay. You cannot get everything you need just by eating well, because no matter how many calories you eat, and if you're just eating the typical American diet, you're getting mostly carbohydrates. When it comes to minerals, you might only be getting 3, only 2, 3, that kind of thing. You need 60. Plants don't make minerals. Nutritional minerals are found in veins like gold and silver. Okay, that's why some people do very well. They say, well, I'm eating the same thing they are. How come they don't have any problem? Well, that's because they live in a place where there's lots of minerals in the soil. And so when you eat your carrots, your cucumbers, and your broccoli, and you're getting 75 or 80 minerals, you only need 60 of the right ones. Let's say you're getting 75 or 80 compared to somebody who's only getting 3. Who's going to be in better shape? Well, the ones that are getting 65 to 70 minerals are going to be in much better shape than the people who are only eating 3 minerals. Okay.
Especially when you've found there's over 600 different poor health conditions directly linked to mineral and nutrient deficiencies.
Well, there you go. And so this is very exciting times. This is going to be one of those miracles, a combination of faith and science. This is a combination of faith and science. And we've been doing this now, as Rebecca says, for 75 years. I've been doing it for 75 years. I started out working with animals. Now I'm the guy that got rid of, and she pointed this out in the introduction, I'm the guy that got rid of cystic fibrosis, one of the most terrible birth defects in humans. And of course, they had it as a genetic birth defect. Well, I was able to find out that it was, in fact, just a simple nutritional deficiency, and was working at the Yerkes Primate Center and ran into the first non-human case of cystic fibrosis in a monkey that was being trained to go to space, a baby monkey, okay, at the Primate Center, and found, of course, that it was missing all these minerals and so forth, and that was what was going on. And they weren't giving them the monkey pellets; they were giving them carrots and salad and stuff like that, and oatmeal. Okay, and that's why the monkey and the 24 of its fellows age, they're like, what, 6 months old or something like that. And they're just really in real trouble. Okay. And so I was able, and so what I did was I took their tissues and I sent them to experts in the field of cystic fibrosis and the metabolic syndrome. And I sent them to these schools. And I didn't tell them it came from a monkey. I just said, I think this is cystic fibrosis. What do you think? They sent back in their letterhead from the universities, these are big hoo-ha medical doctors and so forth. Oh, this is a classic example of cystic fibrosis. So I knew that I'd hit the bingo, okay? Because the experts saying it's cystic fibrosis, It's a simple nutritional deficiency, and I was able to reverse it. And when I wrote the paper, you had to present it to the IRCES faculty to, get approved for submission to get published. When I submitted it to them, they fired me because, well, you're out of your mind. I said, but these experts, you cheated them somehow. Okay, that can't be right. Okay. No, I just sent them the tissues. I didn't tell them it was a monkey. I just said, I think this is cystic fibrosis. What do you think? And they said, it's classic. Here it is. Here's it on their letterhead. And they fired me. And so I was trying to make a living because I had kids, make a living by giving training in events, nutritional and health events, and decided I was going to become a naturopathic doctor, and did. Went to the one up in Portland, Oregon, National College of Naturopathic Medicine, NCNM, and very proud of that. And now I'm doing what they taught me. Okay, plus what I also inserted what I knew from being a veterinarian and what minerals did for animals. I'm the guy that got rid of cystic fibrosis. I'm the guy that got rid of muscular dystrophy, Jerry's kids. I took Jerry Lewis out into the field and showed him about a dozen families where I had gotten rid of muscular dystrophy in the kids who'd had it for 2 years, 3 years, 5 years, 8 years. And he saw them, and the doctors came and they said, we don't know why, but they don't have it anymore. Okay. And it's one of those things where the whole thing was coming together here. And I was able to get a job teaching nutrition at the Naturopathic College. But at the same time, I'm working at the pathology lab to make the money to pay for my tuition and so forth. And so this is all coming together. Now, this was back in the 1980 something, 1990.
Oh, well, you became a naturopathic doctor in what, 1984?
Yeah, exactly. And so since then, we've written about 24 books. This new book, The Metabolic Syndrome, is 25, I believe. And of course, we have the educational brochure. These are available. Okay, and you can get these books. You buy 10 of them, you get a nice big discount. Okay, and of course, it has a lot of my CDs and DVDs. I apologize if you're hearing this beep, beep, beep.
We can't hear it, Doc. Keep going.
Okay, keep going. Okay. And so the metabolic syndrome, and then the CD is going to be as a gift with the book, The Metabolic Syndrome. The gift, of course, is the CD called Hell's Kitchen. And I listened to that again this morning. It's one that I did some years ago. Oh my gosh.
It was only 5 years ago, Dr. Wallach.
Yeah, I didn't remember. I know it wasn't many, so that's why I said some years ago, and only 5 years ago. And so it is full of unimpeachable evidence. Now, here's what the medical doctors are saying. Wallach, you can't say the C word. They get freaked out when they say, we have the ability to deal with cystic fibrosis, muscular dystrophy, and then also I was able to get rid of sudden death syndrome, SIDS. Now, once they're dead, you can't bring them back, but I can prevent it. I can prevent sudden death syndrome. Okay, those 3 diseases, I'm the guy that dealt with it. I'm saving thousands of babies every year, in some cases months, okay, by getting them on the nutrients that are necessary to prevent cystic fibrosis, muscular dystrophy, and sudden death syndrome. Now, we're doing this again now with the metabolic syndrome. And of course, this was a terrible, terrible disease in young people. And now, in the metabolic syndrome, it's one of those things where,
the metabolic syndrome, Dr. Wallach, we're looking across the board.
Yeah.
Ethnic wise, social the economy. Sorry, folks. But it goes across the board. But it does show that the lower income is significantly higher. But I mean, the occurrence of the metabolic syndrome, Dr. Wallach, is pretty high. And I personally didn't hear about it or even the term until 2015 when I was told that I had metabolic syndrome. And that explained why I was overweight. That explained why I was having blood sugar issues. My blood pressure ran low rather than high. I was having some thyroid concerns. Not that metabolic syndrome is the cause of thyroid concerns, but
It
if
can
you
be.
have a thyroid issue, it's caused by nutritional deficiencies, and it can be exacerbated by all these other conditions that fall within the umbrella of metabolic syndrome. And that's what it is. It's a cluster that happens within an individual, cluster of these poor health conditions, Dr. Wallach.
That's correct. And if you have those three, the magic three, abdominal obesity, diabetes, and hypertension, high blood pressure, those three are the core of metabolic syndrome. Now, there's also another 25 nutritional deficiency diseases that you randomly get depending on what nutrients are in the food or not in the food where you live. And so some people will have 5 or 8 deficiencies, 5 or 8 diseases. Some people have 15 diseases, some have 22 diseases, but those core, obesity, diabetes, and hypertension, is what those doctors in 1945 termed the metabolic syndrome. And they deemed it to be a genetic disease. There's nothing you could do but just treat the symptoms. And they were totally ignorant of the full truth.
So let's talk a little bit about the digestive system, because I know there's a lot of digestive complaints that are seen when the metabolic syndrome is present.
Oh, that's
So
correct.
why, Dr. Wallach, would it be digestive as well?
Well, because your digestive system, everything from your mouth, your tongue, to your salivary glands, your esophagus, all the way down to your stomach, the cells in your stomach that make stomach acid and digestive enzymes and so forth. Then you get in your small intestine again, enzymes and so on, absorption. All this stuff going on requires a lot of help, nutrients, okay? And so we're talking, let's see here, sometimes low blood sugar, pre-diabetes, hyperinsulinemia, impaired growth, learning disabilities, ADD, ADHD, hyperactivity, hyperirritability, depression, manic depression, bipolar disease, protein loss, elevated blood triglycerides, elevated blood cholesterol, aortic cholesterol plaque, infertility and low sperm count, shortened lifespan. These are just a few of the things you get when you have the metabolic syndrome. And some people get 3 or 4 of them. Other people, they're not eating correctly, they're not taking supplements, and they're getting 15, 20, 30 of these different things, and they're a mess. And they're on, I don't know, I've seen people who are on 12 or 15 different prescription drugs at a time.
Which is really sad, because if you read those inserts, Dr. Wallach, they even state on them that they may lead to deficiency of certain nutrients that are essential for maintaining good health. So it's baffling to me that you would throw a chemical at something that's going to lead to additional nutritional deficiencies with that one chemical, let alone side effects that could happen to the kidneys or the lungs or the heart. It's just crazy. You get put on a heart blood pressure medication, and one of the side effects could lead to heart attack and death. So it's like, what, Dr. Wallach? If I take supplements, is it going to have a possible side effect of the supplements themselves causing heart attack or death?
Anything's possible.
Anything's possible, but how about probability?
No, you're not going to be getting these diseases from the supplements. Okay.
Right.
And you have to appreciate that, again, minerals are the big ones. We require 60 different minerals. Plants do not make minerals. Plants only need 3 minerals. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And it's one of those things where I have gotten rid of so many diseases And the medical system, they really hate me because I use the C word. You can't use the C word, Wallach. Okay, you don't have the ability to see, see blank, blank, blank.
It's censorship altogether, Dr. Wallach.
Yeah.
We get our hands slapped, and when they slap the hands too many times, they take us off the air. So rather than being taken off the air, we're just eliminating that word all across the board because, Doc, your message needs to be heard. So if I can train you, stop saying that 4-letter word.
I'm not going to say it. I'm going to convert to the R word.
Well, that works.
Yeah, the
Okay.
the R word. We can reverse things, we can repair things, but we're not going to use the C word anymore.
Well, wait. We can't. But when we give the bodies what the body needs, the body itself can.
Yeah, that's correct.
Okay.
And so you have to appreciate when you're deficient, just like osteoporosis of the skull. You have osteoporosis of the skull. There's about 35 different, 35 different diseases you can get from osteoporosis of the skull. Doctors do not get trained about osteoporosis of the skull. They know nothing about it because they see on the autopsy table, I'm seeing osteoporosis of the skull. The skull is what?
I got that picture for you. And
Okay,
folks,
good.
you want to make sure that you have this book as well. It's all in your head as it goes through the different conditions that
Page
are
6, yeah.
to osteoporosis of the skull. And Doc's favorite page is Roman numeral number 6.
Yeah. So the top one is a normal skull, a human skull. The top of the skull has been removed and the camera is looking down on the brain. You'll see that the skull is a 1/4 of an inch thick. The bottom one, the top of the skull has been removed. The camera is looking down on the brain, but the skull is 1.5 inches to 2 inches thick. And there's 12 pairs of cranial nerves, and there's a spinal cord, all of which are generated by the brain, inside the brain, come out through the tunnels. 12 tunnels, there you go, on the left, and 12 tunnels on the right, and then the tunnel in the back of the skull where the spinal cord comes out. Those tunnels, the inside diameter is reduced by 85 to 95%. We have osteoporosis of the skull. And you have things going on, okay? For instance, like AFib, atrial fibrillation. Your heart does really weird things. And the doctors want to do serious surgery. They want to open up your chest and do heart surgery and all this kind of stuff. Really, it's the vagus nerve, it's the 10th cranial nerve being squeezed by your skull, causing the atrial fibrillation. It's not a heart thing, it's a osteoporosis of the skull squeezing the 10th cranial nerve. And so, it's one of those things where doctors are coming at this totally from a different direction. And I've been threatened many times, to have my licenses taken away if I keep using the C word. So I'm going to use the R word. Okay, I'm not going to use the C word anymore. I'm going to use the R word. Okay, repair, replace, that sort of thing. And we've been doing this long enough. I mean, again, I've been doing this, as Rebecca says, for 75 years. Okay, I've seen this in humanity in well, not every, but I've personally been to 30-something different countries. But we're actually with our materials, we're in 80-something different countries. And we're going to be working on more to get this information out there, because we can actually significantly improve the quality of human life. We can add many healthy years to their life, because a human being has a capacity to live to be 145. In America, our average life expectancy is 74 to 75, depending on whose numbers you're looking at. That's far short, okay, of 145. Okay, now Hunza, okay, they live in a place in the Himalayan mountains. Their life expectancy is 120. Many live to be 130, 140. And they don't have any medical doctors. They don't have any health insurance. They don't have any hospitals. But they live in the land flowing with milk and honey. It's not cow's milk or goat's milk or camel's milk. It's glacial milk. It's the rocks grinding up the mountains, top of the mountains. And this milk dust, this dust from the ground up rocks is coming down to the water. It makes the water look like milk. And when there's so many minerals in the soil, more flowers, more bees, more honey. So the land flowing with milk and honey, okay, is based on the what's going on up in the mountains. And so now you know where that came from in the Bible. Now, they didn't know all the science back then. Only the good Lord knew that. And I'm sure he was shrugging his shoulders saying, well, just do it. You'll figure it out soon. Okay.
Yeah.
Uh,
Well, and you talk about the mineral contents of different areas, Dr. Wallach, in this Rare Earths Forbidden Cures, which also talks about your hair analysis, which gives a much better look at where your body is at the moment when it comes to nutritional deficiencies, minerals specifically, and then the ratios and what they should be. So definitely get this book, folks. Again, Rare Earths Forbidden Cures. You can go to drjwallach.com. That is Dr. Wallach's wellness publications website that has all of his publications and the new ones coming soon.
Oh yeah, it's
Well,
very exciting. And of course, a companion book with Rare Earths Forbidden Cures is epigenetics. It's a new science that replaces genetics. Listen to me, it replaces genetics. Okay, there you go. Thank you. And I received the Klaus Schwarz Gold Medal Award for that, and also the Lifetime Achievement Award from the United Nations for all the information that's in there. There you go. This isn't, I'm not bragging. I'm just telling you this is what actually has happened. Okay. And so the whole idea here is to get this information out to everybody so we can add 25 to 50 healthful years to your life. If you avoid the bad stuff, do the good stuff, you can add 25 to 50 healthy years to your life. Now, if you love your kids, you love your grandkids, your great-grandkids, your great-great-grandkids, your great-great-great-great-grandkids, guess what? You will want to live to be 105 in a healthful, functional, productive way. And so that's our goal, is to get as many people as possible to live beyond 120. Okay. We have Jean Calment, Maryland, I think she's from, Jean Calment. In 1995,
it was from France, Dr. Wallach.
oh, I thought she was on her. Jean Calment, I thought she may have been from France, but she was in.
But we'll have to look into that. But yeah, she's the longest living on record.
In America, 122 years.
122 years. So
122.
yeah, I know, Dr. Wallach, at 40 years old, I couldn't imagine what life would be like growing older. I mean, even at 30 years old, when I fell and I got compression fractures in my spine and had to see the neurologist at the University of Washington, he came in and turned around and went back out. And when he came back in, he's like, I'm sorry, I thought I was coming in to see somebody at least 65, 70 years old in very poor health, not what appears to be a fit 30-year-old female. And it just goes to prove that, these diseases, these poor health conditions that we commonly associate with growing old can start very young. But through your research, you have found that it does not have to be that way. And through my experience, I have found that I don't have to stay that way. So we invite each and every one of you to feel the difference of what full 90 essential nutrients for life each and every day can actually feel like, how great it is.
Yeah, and of course, we're moving through many, many different disease categories. Another big one we're doing is Parkinson's disease. Parkinson's disease, for many, many years, the whole number of new cases each year of Parkinson's disease in America each year was 60,000 new cases a year. That blew my mind. 60,000 new cases a year. Well, this last year, it was 90,000. It went up 50%. Went from 60,000 a year to 90,000 this year. Okay. And I'm willing to bet you a dinner anywhere in the world. I'm willing to bet you a dinner that this happened because doctors went to some kind of convention. They're all told to help people by getting them to lower their cholesterol. And here's this new cholesterol lowering medication, blah, 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 blah. And so the doctors came home, they got all their patients on this cholesterol lowering medication, And that's why the Parkinson's disease went up 50%, because Parkinson's disease is a loss of the myelin, white matter of the brain and spinal cord. And Parkinson's and the myelin is made out of cholesterol. Okay, your liver converts the cholesterol into myelin. And if you're taking anti-cholesterol drugs, you're stopping that process from taking place. Okay. And so that's why we had a jump of 50%. Now they're the ones that published this in the public venue of newspapers and magazines and on the radio and so forth. They're just shrugging their shoulders. Well, I can anticipate what it was being a pathologist. Okay. For that many to happen, it had to be something that they all did. All the doctors treating their senior patients. Oh, we're going to give you cholesterol lowering medication. That's going to help you live a few more years. When they lowered the cholesterol, it gave them Parkinson's disease, because Parkinson's disease is caused by a lack of cholesterol. Now you go to page 25. I kept saying it was 26 or 27. It's actually 25. Go to page 25, and it talks about Madeline O. Her first letter of her last name.
I'm like, what book are you talking about, Doc? So yeah, in the flip chart.
Yeah.
95 Crusade.
95 Crusade to save humanity and the world, right? So
yeah.
Okay. And page 25, it tells the story of Madeline. Her last name begins with an O. I'm not going to give her whole name, Madeline O. Because if I were to give her name out, thousands of people would be at her house tomorrow. Okay.
Yeah.
Because
we don't want to do that.
For 11 years, she was diagnosed with Parkinson's disease, getting slowly worse every year, and going to see her doctor anywhere from once to 3 times a year, depending on how she was feeling and what was going on. But she was slowly spiraling downwards. And doctors are shrugging their head and saying, well, it won't be long now. We apologize, but it's your time is coming here. You've had this for so many years. And we got her on our program for rebuilding the myelin in the brain and spinal cord and the large nerves. And in 2.5 months, she goes in for another exam. The doctor said, nothing came out right. So come back tomorrow. We'll make sure that all the machinery is working right and so forth. She came back the next day. They redid everything, and they had to admit that she didn't have it anymore. Now I can't use the C word, but this is published in medical journals. Okay, this is one of those things where this is the R word. I have removed this. I believe we can get everybody. Okay, most people, maybe 95% of the people with Parkinson's disease, if we get them on the program, they're going to see benefit. They're going to see benefit.
I believe it, Dr. Wallach. For Madeline, 11 years consistently having that diagnosis and in the chart of Parkinsonism, and then on year 12, she goes in and they do their battery of tests and they no longer find any symptoms of it. And she was feeling great and being able to go out and do things that she wasn't able to do. So I think that's absolutely fantastic, Dr. Wallach, that we have in our toolbox what is needed to empower people to take their health into their own hands. And it all starts with the 90 essential nutrients and the good foods, bad foods list. So folks, if you don't have a copy of the good foods, bad foods list, you can go to DailywithDoc.com and you'll find there right in the menu, the 10 bad foods. It also includes the good foods. So we don't just say don't, but we give you a whole list of things that are great to include in your diets. And in the newest book, Metabolic Syndrome, that is going to be in the book on the back cover. So that'll be something that'll be a resource that you'll be able to refer to often. So I'm excited to be able to include that and make it easy to find for folks, Dr. Wallach. Now, Dr. Wallach, we do have some hands up. We only have about 15 minutes, so let's go ahead and take some questions.
Okay.
Go ahead and what questions are you bringing to us today?
Hey, Dr. Wallach, how are you today?
Very fine, sir. How are you doing?
Doing well. I got a question from YouTube and we have a question from the chat. But just real quick, I wanted to mention, I had heard you say in the past the I-26, and you like the chewable, you like the vanilla flavor, and you like the taste of the chewable. And the first time I took one of the chewables, I was like, well, what is Doc talking about? But now I find myself always eating the chewables because they actually taste pretty good. But at any rate,
Also, they're going to make you smarter.
that's what it must be for sure. So a guy on YouTube, L. Anderson, mentions that he is wondering about osteoporosis of the skull, but he's got this symptom of, it feels like his hands are over his ears. So I guess it's a muffled sound that he's getting in his ears. He's not able to hear well. And he's wondering if this is osteoporosis of the skull.
It's certainly a possibility, because the cranial nerves, okay, I think it's the 8th cranial nerve, deals with hearing, okay, tinnitus, ringing in the ears, deafness, loss of hearing, Meniere's disease, Wallach's vertigo, okay, and when you look at the osteoporosis of the skull, there's 12 pairs of cranial nerves, and so you can have, it's like when people get osteoporosis, they get more osteoporosis maybe in the right arm, and so, it's just not equal in the right and left arm, kind of thing. Well, the same thing in your skull when you get osteoporosis. And I love it. We have the picture of the skull and all the nerves coming out and what organs and tissues they go to. Okay, and we showed you already the normal skull and the osteoporosis skull. Okay, and you can see how those tunnels that the nerves and the spinal cord were going through are being filled with all this connective tissue. Okay, and so when the cranial nerve number 1 is being squeezed, the olfactory nerve, you lose your sense of smell. I just can't smell anything anymore. Okay, cranial nerve number 2, optic nerve, atrophy. Okay, you're slowly losing your vision. Okay, oculomotor nerve, ptosis. This means that your pupils do not respond to light. Trochlear nerve, double vision, palsy, pain above the eyebrows. Cranial nerve number 5, trigeminal route, is the biggest nerve. And of course, you get all kinds of stuff going on when you have that one being squeezed. Pain in your face is terrible. Abducens nerve is cranial nerve number 6, double vision, eyes turned inwards towards your nose. You see people like that all the time. Cranial nerve number 7, the facial nerve, Erb's palsy, Bell's palsy, one side of your face droops and sags. Let's see here, vestibulocochlear nerve, number 8, tinnitus, ringing in the ears, deafness. Now you just don't go from hearing to deaf. You go from hearing to, you're slowly losing your hearing, which is what this gentleman is talking about here. He's slowly losing his hearing. And it could be on one side, it could be on both sides. Meniere's disease, balance problems, Wallach vertigo. Okay. Loss of pharyngeal nerve number 9, loss of the gag reflex. His taste is gone, can't taste foods anymore. Difficulty in swallowing, voice changes. Vagus nerve number 10, gastroparesis. You just really have terrible things going on in your digestive system. COPD, chronic obstructive pulmonary disease. Then you have hiccups, abnormal heart rate, AFib. We already talked about the AFib. The doctors want to do heart surgery when it's really the 10th cranial nerve being squeezed by the skull causes AFib, atrial fibrillation. You fix the skull, the heart goes back to beating regularly. They want to do heart operations, okay, which has a potential for permanent injury or death. Okay, so, there you go. Accessory nerve number 11, loss of the function of trapezius muscles and the sternocleidomastoid muscles. So when you have a squeezing of the 9th cranial nerve and the 11th cranial nerve, your communication is gone pretty much. Hypoglossal nerve, okay, number 12, atrophy of the tongue, speech malfunctions, swallowing malfunctions, and then the spinal cord gets squeezed. Oh my gosh, Erb's palsy, Bell's palsy, Wallach's fibrous dysplasia, okay? And you get all this stuff going on from the neck down. And you look in this book, again, Rebecca showed you that picture. where it shows you the underside of this brain. It shows all those nerves and spinal cord coming out, going to the different tissues of the body, different locations. And so this is very simple, that, you know, even if you can only look at the pictures, you'll learn more than most doctors know about osteoporosis of the skull. This is repairable. And so I urge everybody to consider this. You can ask your doctor about it, but they won't know much about it because they don't get taught this in school. And if they don't get taught in school, it doesn't exist in their minds. But we have proven it over and over and over. And so I hope that answers the question.
Well, it does, Doc. I guess we know what the protocol is for osteoporosis of the skull.
Yes.
So that does handle it. Hopefully he'll reach out to us. I think the next question I had, the person has their hand up about sarcoidosis. So hopefully they'll get to it. I appreciate you, and I can't wait to read the new book on the metabolic syndrome.
Oh, thank you. Yes. Oh my gosh. This is going to be, again, also they get a free copy of the CD that goes along with it. Okay. Hell's Kitchen. I listened to that again this morning. That's Rebecca was reminding me that Hell's Kitchen, the CD came out, what, 5-6 years ago?
About 5 years ago. Yep.
5 years ago. Yeah. That's the CD, Hell's Kitchen. And it goes into so much detail of all the, not all, but so many great studies on nutrition and what happens to you when you're not doing your nutrition correctly, you're not absorbing correctly, you're doing bad things when it comes to eating and food choices, no supplementation. That CD, along with this book, Metabolic Syndrome, is going to save so many people's lives, increase their quality of life, and add many healthy years to their life. Everybody should live to be at least 120, like the Hunses, and okay. And just like Jean Kelman, she lived to be 122 in some days. I think 122 years, 180 days.
122 days. I mean, 122 years, 164 days.
Wow.
And she is the world's she's a super centurion. She was the world's longest living documented individual of the world. So not just the US, Doc. She was in France. Well, we have just a couple more minutes, Doc. So let's go ahead and individual user, go ahead and unmute yourself. I'm asking you to unmute. And Dr. Wallach, let's see. Nope, they're not coming unmuted. But here's the question. And it does have to do with sarcoidosis.
Sarcoidosis.
Thank you. On the back of the head, on the left nostril, under the left eye. So this is a gentleman. We don't have a weight or height, Dr. Wallach, but for first of all, what is this? And then what is causing it, and what is the solution?
Okay, well, sarcoidosis is where you get problems with the muscles and tendons and ligaments and bones and nerves on one side or another, or both. It could be both, okay? And so you're getting all this paralysis and tingling and pain and all this kind of stuff and dysfunction. And it can be just simply osteoporosis of the skull. And, excuse me. Osteoporosis of the skull. And it's one of those things where, again, doctors put them on drugs to reduce the symptoms. They really don't get to the basic root cause of the problem. They just attribute it to something that's either genetic or aging or this, that, and the other. Oh, you got it in your family, it's genetic. And they just give them something to reduce the pain and the and swelling and so forth. And it slowly gets worse and worse and worse, and then the end comes. And so it's one of those things where it's easily resolved, easily reversed. And this is all going to be in the book, The Metabolic Syndrome. So this is going to really change how humanity lives. The quality of their life is going to go up. Their lengths of their lives around the world is going to go up, all because of this book and CD.
So Dr. Wallach, one of our viewers here in the Zoom room, Barbara, she mentioned that she had this condition in her lungs. And I know she is on the program, and that word had is she left it in the past. Because is it a nutritional deficiency, Dr. Wallach?
Oh yeah, osteoporosis of the skull is nutritional deficiency, just like osteoporosis of your hip and your leg bones and your shoulders and your vertebrae. It's all nutritional deficiencies, and the symptoms you get depend on the location of the worst levels. In other words, where you have the most osteoporosis, you get the worst symptoms.
Gotcha. So for a protocol for this individual, let's go by 100 pounds.
Okay, get rid of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, butter, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And then per 100 pounds of body weight is 1 healthy brain and heart pack per month. They weigh 140, 150 pounds or more, I'd go with 2 healthy brain and heart packs per month. If you only weigh 130 pounds, it'd be your 120 pounds, be 1 healthy brain and heart pack per month. Take a half of those everything twice a day. They also need the I'd go with the glucogel. I guess there's glucogel in the healthy brain and heart pack, but it wouldn't hurt to get some more. So you can take
No, there's no glucogel in the healthy brain and heart
okay.
pack. So
And they need
definitely
2 bottles for 100 pounds, 2 of the glucogel bottles. So they can take 3 at breakfast, 3 at lunch, 3 at dinner time to help regrow cartilage, ligaments, tendons, connective tissue, bone matrix, and all that kind of stuff. And then let's see here. They also need the I-26.
Mhm.
I-26, rebuild the myelin in the brain, rebuild the brain, the spinal cord. And I only weigh 142. Sometimes I get down to 137, something like that, but it's in that range. And so I take 2 or 3 of the I-26 chewables. I like the French vanilla, but we sell more of the banana coconut of the I-26. It rebuilds the myelin. And that's why it worked for our dear friend.
Barbara.
I'm sorry?
Worked for that. Oh, when we're talking about what is sarcoidosis?
Sarcoidosis, yeah. Sarcoidosis, yeah. It's kind of related to Parkinson's disease. It's all kind of the same area, okay? And so you can have both. You can have sarcoidosis and Parkinson's disease, okay?
So let's not wish that on anybody, Dr. Wallach.
Well, but it's just, you got to be realistic, because you can have, just like the metabolic syndrome, you can have 35 different diseases because of metabolic syndrome.
Right. Well, that's what we're here for, Dr. Wallach, is to help people avoid having to go there. And if they have reached it, the good Lord gave us the ability to make a U-turn, Dr. Wallach.
Yeah, we can make a U-turn. We can improve them. We can improve them. We can improve them. We can reverse them. And so it's just a matter, and just think about it. Each individual has the capacity to prevent and reverse and eliminate Parkinson's disease, sarcoidosis, all of these different diseases.
High blood pressure.
High blood pressure,
Yes.
heart disease, diabetes, obesity, all these things. We have the control to prevent and reverse these things with supplement programs and diets. You'll save a lot of money, and you'll add many healthier. You can add 25 to 50 healthier years to your life by just doing these simple things. And I'm sure doctors jumping on me like, well, I didn't say the C word. Okay.
Well, you did good. I'm proud of you, Doc. We are at the top of the hour. I do apologize, folks. We did not get to all the hands today, but please join us again tomorrow on Daily with Doc, same place, same time, dailywithdoczoom.com from 12 to 1 p.m. Pacific time. And just a reminder, this program is for educational purposes only. It is not meant to take the place of your primary care physician, nor are the products mentioned used to prevent, diagnose, or cure any disease, folks. But when you give the body what the body needs, the body itself can do some amazing things. So Dr. Wallach, thank you so much for joining us once again here on Daily with Doc. Folks, if you were shared this program by somebody specific, make sure that you get back with them. Tell them thank you for sharing this information, this program with you. And if you are listening and or watching and you think of somebody that this information could benefit, make sure that you share that with them. You did not hear this by accident. So we encourage you to share and be part of the solution, folks. And as you are sharing, I would like to have my co-hosts come up with me because they also are sharing this message. And we as individuals have benefited from the information that Dr. Wallach has presented in our programs. We also have found the value in what we ourselves have received when it comes to our health and wellness, that we want to share it with others. And as we do share it with others, we do get a thank you check for doing so. That's just the way Dr. Wallach set it up in the beginning. Instead of paying big box stores, he wanted to help us little guys and do something that allows us tax benefits and having our own business with purpose that helps other people. So we invite you to look into our opportunity. Again, if somebody shared this program with you, get with them, say, hey, how can I be part of this crusade, part of this solution? If there's no one to thank, feel free to give us a call at 855-949-3377, 855-949-3377, or send us an email at info@dailywithdoc.com. Again, info@dailywithdoc.com. Now we have kind of a slim group here on today with us, but they did a fabulous job. We have Marilyn, who does the dictation and transcription of what's being said and puts it into the chat here. One of the biggest benefits of being here live with us, besides being able to raise your hand and ask questions. So thank you so much, Marilyn, for doing that. We have Ruth Ellen here with us, who is my executive prediction manager, where she makes sure everything it stays organized, keeps us on task, and helps with the technical side of it in getting things set up before the show. And we have AJ, who is also part of our technical staff and also social media. And he's the one who has been very instrumental in getting us on all the different platforms that you may be listening to or watching us on at this moment. So we'd like to know where you're at. Send us an email at info@dailywithdoc.com and let us know what platform you are listening to us on. My name is Becca Dukes. Thank you so much for investing this hour into yourself and getting information that you can actually take action on and change your tomorrows. Have a wonderful day, and we'll see you tomorrow.
Thank you, Becca. Thank you, team. Thank you, everybody. God bless.
Thank you, Dr. Wallach. We love you.
We
Mwah.
love you too, dear.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.